There are two approaches that can be made. You can say, how severe is the hazard? And therefore you provide protection against that. The hazard can be fatal, right? We know that. So you can have isolation and you can have personal protective equipment to prevent cross-contamination, contamination. That's one aspect. The other aspect, the employer is looking at it and say, what's the likelihood that something can happen? What's the risk? And the risk is extremely small. We have to identify people and blah, 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 unless somebody is extremely sick before they can shed the virus, etc. So they are looking at it from the risk. We are looking at it from how severe the hazard can be. And therefore protection should be provided to insulate the persons, right? Likewise, there's the other area that we have got to look at that I have not thought it out in my head. If somebody gets sick, get involved with this Ebola, what would happen to the person continuously? I know we have workers' compensation and that, but is that sufficient if something happens? You have people, field workers going out. Right? You never know what's going to happen. Part of your job, public health advisor, social worker. I understand the confined space of the hospital and that sort of a thing, right? But once you go out in the field, that's a different question. How do we really evaluate that? So that's a different component of education that ought to be done, you know? So we are working on that, right? Those two aspects of it. And I just say, I've not thought it through in my head. If a policeman get injured on the job permanently, he can be compensated. You know, what happened to our people? How do we fall into that severity? Just like in 9/11, you see, we are still, Sister Gay, your office is still dealing with the fallout from that. So if we have something here, how do we deal with that? But that's something that you cannot just open your mouth and run your mouth. You have to think it through, what the implications are, how do you deal with that, you know, that sort of a thing, right? So that's something that we have to deal with. And the third aspect of it, we have got to recognize that we are in healthcare, right? And healthcare affects everybody. And therefore, we have got to have the staffing to deal with that. And that's not from me. All the unions, Sister Roberts, Brother Garrido, he spoke about this at Monday's MLC meeting about the agency, how do you train agency, right? So it's a whole lot of implication and people are pushing extremely rapidly about it. So I just want to tell you there are these other dimensions, agency and these things that are there, right? How do you pay, you know, to deal with this sort of a thing, right? You have people, I said the last point, you have people who deal with sewage treatment. You know, what happened to the waste and these sort of a thing. So there are a number of other dimensions that are being discussed, debated. People have not really gotten their heads around it, right? And that sort of a thing. So the union is
very, very true. I just want to touch on 2 points. Time and leave issues are being looked at, and because of the implications for someone having to be away for 21 days. If God forbid you had contact, those things are being addressed. And then 2, I did actually have a telephone conference call today with the Department of Labor, the Public Employee Safety and Health Bureau, to see what kind of guidance they're providing to employers, because under the PESH Act, Ebola falls under the bloodborne pathogen standard. I mean, if you're familiar with the bloodborne pathogen standard, you know that the employer has to have an exposure control plan in each facility that addresses the risk for workers who have contact with blood or urine or bodily fluids. And so this is obviously a regulatory issue. And so PESH is going to be putting something out shortly to inform the employers that they do have to comply with all these regulations. And then obviously if there's a case and there are problems, then we have to deal with the regulatory agencies on that.